Greetings to one and all present. The topic of today's video is aphasia, its causes and diagnosis. I am Gauri Pathak. I work as a consultant speech and language pathologist at Kothrud branch of Sampark e-Polyclinic, Pune. So what exactly is aphasia? Aphasia has been defined as a loss or impairment of language function caused by any sort of brain damage. So the major symptoms of aphasia are impairments in spoken language expression, that is difficulties in expressing their thoughts and feelings. It can be an impairment in spoken language production as well. The second is impairment in spoken language comprehension, that is difficulty in understanding. Then is impairment in reading and impairment in writing. So there are two major types of aphasia. First is fluent aphasia, where there is verbal output present, although it can be incoherent. However, their understanding is very much affected. Second is non-fluent aphasia. So there is no or minimal verbal output. However, their understanding is very much intact. Then these are the most common causes of aphasia. So the most leading cause of aphasia is stroke, followed by traumatic brain injury, followed by brain tumors, surgery, brain infections, and progressive neurological disease. For example, dementia. So any injury or any tumor that affects the lobes of the brain where language is intact or where language is stored can cause aphasia. So these are the team members involved in assessment and management of a person with aphasia. So what do we SLPs do? So we work to prevent, that is we identify the red flags. We identify the red flags because of which cause of aphasia can occur, for example, stroke. So stroke can occur due to diabetes or hypertension, and we create awareness. Then we work to assess and differentially diagnose as to which type of aphasia it is. Then we form an individualized speech and language therapy plan. We teach them speech and language therapy techniques in the therapy setup. And we counsel the person with aphasia as well as the caregivers. So the main skills that we work on are speech, language, swallowing, cognition, communication in a person with aphasia. So there are two general types of therapies. So first is impairment-based therapy, which is aimed to improve the language function. So this works on all the skills that are affected, and it is very individualized. Second is communication-based therapies, which are intended to enhance the communication by any means with the support from the caregiver. So this helps to make the environment around a person with aphasia friendly and removes the barriers and facilitates the communication. These are the major therapy goals that we work on. First is improving communication skill, then is compensating for the challenges in understanding or using spoken language. So we teach them compensatory speech and language therapy techniques, as well as if the person with aphasia has difficulty in spoken language production, so we give them alternate mode of communication, that is, for example, gestures, writing, or high-tech devices, for example, text-to-speech, which helps the person with aphasia to communicate. It can be as simple as picture exchange communication. Then we work to increase vocabulary of all the activities in their daily needs. We teach them compensatory strategies in the speech therapy. We work to improve their reading and writing skills. So what are some of the tips that you can follow at home if your loved one has aphasia? So first is to reduce noise and to reduce distraction. So if you reduce the background noise, the message that is conveyed to the person with aphasia is delivered clearly and there's no hindrance. Then second is facilitate communication. So you should speak as much as possible and aid communication with the person with aphasia. However, you should always remember to speak very slowly. Take as many pauses as you can, use simpler sentences. So what this does is it provides a person with aphasia time to process what is being said. So it gives them extra processing time. You should always modify your questions. So ask open-ended question. For example, so ask close-ended question. For example, do you want water? So the person has to say yes or no. And even if you ask open-ended question, you should always provide cues. So example, how are you doing? So I am doing fine, or no, I have pain. Then you can also use visuals. So this is one visual that I have shown here. So for example, the person with aphasia is in pain, but then he can show that I am in pain, and but however, he should show where it is located. So is it in his leg? Is it in his foot? And if he has fever, then he can show I feel sick. You should always be calm and be patient. Remember that therapy takes time. However, it definitely is very effective. This is our clinic address. You can contact us on this number. Thank you. I hope this video is useful for you.